This video continues Chapter 23 of OEC 6, Chest Trauma, by looking specifically at the types of injuries that may occur. Now, there are several to be covered, so we'll only look at the first half of Objective 23-2, including contusions, fractures all the way to multiple rib fractures such as a flail chest, and we'll look at aortic dissection and rupture. Key terms to consider are flail chest and, along with it, the idea of paradoxical motion. And when we consider contusions, we'll look at both pulmonary and myocardial contusions and one of the symptoms, which is hemoptysis. So with common chest injuries, we can divide them into closed chest injuries caused by blunt trauma, such as a fall or a collision, and open chest injuries, where we have penetration of the chest cavity, and this may result in a sucking chest wound. Also, compression may be an MOI for chest trauma, and we would have force applied to the heart or lungs and the skeletal structures there, including the ribs, and we can expect internal damage of thoracic structures to occur. A final MOI to consider is sudden deceleration, such as striking an object and coming to a stop abruptly, and this may damage the aorta. So the chest is susceptible to a variety of soft tissue injuries as well. Minor blunt trauma will appear as swelling, bruising, or pain. Think about assessment and decap bottles on the exterior part of the chest. Internally, significant MOIs can occur even if the skin over the rib cage has not been penetrated. We can have closed chest injuries. Always consider whether the organs internally in both the respiratory and cardiovascular systems have been injured. We can see this in the case of an external contusion, that bruising, but consider internally what may happen. Contusions are simply bruises in which we have ruptures of capillaries, and in the case of a pulmonary contusion, that rupture of the capillary will cause adjacent alveoli to become filled with fluid and blood. This will compromise gas exchange and lead to hypoxia. A pulmonary contusion can occur in a patient with a rib fracture even if we don't have directly laceration of the lung tissue. One of the symptoms we may see is hemoptysis, which is literally coughing of the prefix hemo means blood. Now, similarly, we can get a myocardial contusion, and the prefix myo means muscle, so we have bruising of the cardiac muscle. That may cause heart contractions to become less effective, and in a severe case could lead to arrhythmia and cardiogenic shock. Now, a second type of injury to consider are fractures. And those impact type fractures could be any of the bony structures of the thorax, or along with that, internal damage that can occur. Clavicle and rib fractures are very common chest injuries in the skiing and snowboarding population. Now, they can result in impaired breathing. The breathing will be shallow because deep respirations are just simply too painful. You may see a patient guard or self-splint and put direct pressure over an injured rib to just keep the fractured bone ends from moving. If the sharp end of a fractured rib lacerates underlying lung tissue, that can be very serious. The elderly are at high risk just because of brittle bones. And in extreme cases where multiple ribs are broken in multiple places, we get a flail chest. That is, fractures of 2 or more ribs in 2 or more places, such as we see here. Now, that flail segment, because it is no longer anchored to the spine posteriorly or the sternum anteriorly, will result in independent movement of that. And we call that paradoxical motion. The flail segment will move inward upon inspiration while the rest of the chest expands outward, and then the flail segment will move outward during exhalation when the rest of the chest is reducing its volume. We'll see severe pain in the chest wall, and again self-splinting to try and guard that area and hold the flail segment in place. The forces required to produce a flail chest, remember, breakage of 2 or more ribs in 2 or more places is likely to cause other internal injuries. Sternum fractures can be associated with life-threatening injuries as well. Just consider the strength of the sternum as that large anterior bony structure protecting the thorax, and you can anticipate that a large amount of force is required. Subsequently, we can expect injuries to underlying organs. It's very rare, but you may have a flail sternum if the ribs on both sides were to become fractured as well. The most common cause could be chest compressions during CPR or high-speed blunt trauma. Seatbelts in a motor vehicle accident will help prevent this injury by just holding a driver away from the steering wheel in the case of a crash. Rapid deceleration injuries are also a common source of injury to the thorax. For example, hitting a tree and going from a high rate of speed to 0 could lead to an aortic rupture. The aorta is attached to tissue near the heart, and you can result in a tear during a deceleration injury. When the moving body slows or stops rapidly, the internal structures will stay in motion. We get essentially application of Newton's first law. The upper aorta is especially vulnerable to this deceleration, and the rupture or tear that occurs to the largest artery in the body can lead to rapid hypovolemic shock and depth. Let's take a look at what this may present as. In addition to a full aortic rupture, we could have an aneurysm, which is the ballooning of that part of the aorta, or an aorta dissection in which the layers of the aorta end up with blood in between them. Those two cases can also eventually lead to an aortic rupture. The patient will present with acute chest pain, and sometimes that radiates to the back between the shoulder blades. They'll appear gravely ill. Consider this in part of your scene size-up. The patient will be exhibiting signs of shock and is likely to be pale, cool, and clammy. If the tear in the aorta is between the large arteries that go to each arm, you could actually see a difference in blood pressure in the two arms. Rapid transport is our essential treatment. Finally, we can see lower rib cage injuries, and in this case we're looking at this soft tissue, the cartilage on the bottom of the anterior rib cage being torn or separated from the bones. So this will mimic the pain of a rib fracture and may result in shallow breathing, hindering the breathing. But since we don't have X-ray vision, differentiating it from a broken rib is impossible in the field.